Hello, and how are you? My name is Winnie Barawa. Welcome to our session on the Kenya Healthcare Policy Framework. And if you've been joining us, you've realized that this particular moment we've been discussing a lot of causes on health system management, focusing on health planning and policy. So we have introduced the healthcare planning as a process, introduced the cycle, checked on the challenges, and we've checked also on the different types of health plans that are available or can be developed. So now, being in Kenya, you discover that the Kenyan government is guided by policies, and these policies keep being updated from time to time. So Kenya has developed several policies that are promoting the health provision and delivery in our country, originating all the way from the famous Kenya Health Policy 2014 to 2030. And if you know of many Kenyans, they talk about the Vision 2030, which is part of the health policy 2014 to 2030. Currently, we have the primary healthcare policy, and currently we have launched the Kenya Community Health Policy. Now, when you talk about policy frameworks, they are long-term, or rather we talk about the long-term plans or the long-term policies. And in this class, we want to focus on this particular area. So if you're new here, my name is Winnie Barawa. Karibu sana and stay with us all the way to the end. So we are discussing about healthcare policies that are guiding different sectors in our country. But now in Kenya, we need to appreciate that there are health plans that have been guiding the healthcare delivery system in Kenya for the longest period ever. Let's trace it back to how history began. So with the Kenya healthcare system, we have the healthcare policy framework that was made in 1994 and was planned to end in 2010 or 2010 rather. Now, if you calculate this policy, it has been extended to the period where we talk about more than 10 years. Therefore, this is a long-term plan. So what this plan was supposed to do, it was provided to actually act and provide the overall policy direction. And to achieve this, there was development of the medium-term policies, which was made up of the medium-term policy number 1 and the medium-term policy number 2. So this medium-term policy were known as the National Health Service Sector Policy number 1, 1999, that ended on 2004. Thereafter, they developed now the second medium-term policy that they call the National Health Service Policy number 2, that was enacted from 2005 to 2012. So this was the medium-term sector, this was the medium-term strategic plan that was to help us in completing and achieving our Kenyan Health Policy Framework 1994 all the way to 2010. Now, I want you to see how the long-term policy is being supported by the medium-term policy. So in this history, you can see the long-term policy was the Kenya Health Policy Framework 1994 to 2010. But again, with the purpose of supporting it, the government developed the medium-term policy, and that is the National Health Service Strategic Plan number 1, 1999 to 2004. And then we had the second one, which ran from 2005 to 2012. Now, I want you to appreciate that actually you are allowed to update your policies. If you feel a policy has been developed and it has not categorically or adequately met the objectives, you can always update it and have it elongated or shortened for the purpose of covering the needed outcomes. So keeping it on, after the completion, after the establishment of the health policy framework, there were also other strategic plans that were developed to meet or rather to sustain our long-term policy. And here we had what we call the MOMS. So let me give this in full what it means. So the MOMS was the Ministry of Medical Service and the Ministry of Public Health and Sanitation strategic plans. And these strategic plans had the medium-term plan number 1 that was running from 2008 to 2012, where the main purpose with this plan was actually still supporting the Kenya Health Policy Framework 1994 to 2010, but there was a key focus here. We were focusing on the Grand Coalition government. I want you to remember that in Kenya in 2007, we had the skirmishes and there was tribal wars and there was so many confusion that happened in our country. So what happened is when the Grand Coalition government came in, now the Ministry of Medical Services and the Ministry of Public Health and Sanitation, as we used to call it then, came up with a new strategic plan, or the medium-term plan number 1, that was used now to help in achieving or focusing on the specific focus that the Grand Coalition government wanted to focus in regards to health sector at that particular time. So as you can see how interesting looking at policies can be. You have your long term that is being supported by, but again, we need to appreciate that as a country we grow. So once we were able to establish our long-term plan of 1994 to 2010, we then now updated into what we call the Kenya Health Policy 2012 to 2030. So which was actually the new vision that was created during the Kibaki era or the Grand Coalition government. So what happened is this was endorsed in the September of 2012, and with this it was to capture long-term policies that were relating to health, but with key focus with 2 new documents in place for the country. So in 2010 we came up with the new constitution, that is the Constitution of Kenya 2010, but also in 2010 we developed what we call the Kenya Vision 2030. So overall, our Kenya Health Policy 2012 to 2030, the main focus was to take care and ensure we meet the sector-wide policy in terms of the Vision 2030. So we were literally working here or coming up with plans that will help us fulfill our Constitution of Kenya of 2010 and to fulfill our Kenyan Vision of 2030. Now remember, the Kenyan Vision 2030 is big. It covers so many sectors in Kenya, from technology, education, health, and all that. So the Kenya Health Sector Policy of 2012 to 2030 was to just look at the Kenyan Vision 2030 in relation to health. What was it going to cover? So how are we going to support our long-term plan? In this term, we are referring to the Kenya Health Policy 2012-2030. We are going to support this by developing what we are calling now the medium-term policies. So the medium-term policy here that we developed was now including the Kenya Health Strategic and Investment Plan running from 2013 to 2017. If you look at this timeline, this is literally like 5 years. So this now stipulates as a medium-term plan. After the 2017 investment plan or strategic plan had ended, we then came up with a medium-term plan number 2, and all these medium-term strategies or plans were simply focusing on achieving our Vision 2030 and the Kenyan Constitution 2010, with key focus on health and key focus of healthcare for the government, for the population. All right, so currently what is in our country that is updated? So after coming up with the Vision 2030 and the policy that was to cater and focus on the Vision 2030, Kenya have been updating more medium-term policies that will help us achieve our Vision 2030 goal. And as you can see, in 2019, we actually launched the Kenya Primary Healthcare Strategic Framework. What the Kenya Primary Healthcare Strategic Framework does, it was to cover for the period of 2019 to 2024. And as you can see, 2024 will be ending up just next year. So what primary healthcare did was trying to bring healthcare accessible and being affordable to each and every member of the community. So the target was to ensure that healthcare can be accessed by literally each and every member of the community in Kenya. So with this primary healthcare, we came with now change in, for example, the delivery system, where we now started having the national government, the county governments, all the way to the lowest cadre in the community. So that was the main agenda for the Kenya Primary Healthcare Strategic Plan. But now the current policy that we are working on is the Kenya Community Health Policy that our government recently launched it during the Mashujaa Day in Kericho. What this policy is focusing on community health promotion, where we want to bring active participation of community health workers and community health extension workers to be part and parcel in terms of prevention prevention and spread of illnesses. And so the government is bringing in inputs and strategies of how to ensure that health can be brought to the lowest level of our community. And that is now like focusing on the level 1 of healthcare delivery system. So these are all strategies, but the main target is promoting and ensuring that we are able to achieve the Kenya Strategic Healthcare Plan 2014 to 2030. All right. So saying that we are mainly bringing in all these medium-term plans and strategic plans to achieve our Kenya Health Policy Framework 2012 to 2030, we need to appreciate that this policy was formulated or was developed for the purpose of achieving, number one, the Constitution of Kenya that was done in 2010, and it was done also based on the Kenya Vision 2030, but it was also a review, or rather it was born from the Kenya Health Policy Framework 1994 to 2010. So like I've told you, you can develop framework from your previous framework by building up and making a few changes or enhancing it to have bigger impact and outcomes. So with all this sector, with the health policy framework, what it does is it includes all the actions that cut across sectors, but we're looking mostly on the impact that it will have on the health, with key focus on achieving the Constitution of Kenya 2010 and realizing our Vision 2030 goals, and that specifically in regards to health. So this is a very good framework when we are looking at a category of the long-term policy frameworks or the long-term plan, which covers 10 years and above. So moving on, when you're looking at a policy or you're looking at a long-term plan, you have to look at the policy goals, policy objectives, policy directions, and so on. So let's start looking at each and every component that relates to our policy framework 2012 to 2030. The ones that is focusing on our Vision 2030 and is focusing on the Kenyan Constitution of 2010. So the goal of our Kenyan Health Policy Framework, number one, was to attain the highest possible standard of health in a manner that is responsive to the population needs. So this is the goal of the Kenyan Health Policy Framework 2012 to 2030. It wanted to attain the highest possible standard of health with response to the population needs. Well, the population needs are many, and they are guided by the different specialties and health services that we give. So the main goal is to ensure that all these standards are met and the population needs are also catered for. Then the other part of the policy was the policy aim. So the Kenya Health Policy Framework 2012 to 2030 was aiming at supporting the provision of equitable, affordable, quality health and related services at the highest attainable standards to all Kenyans. So with the policy aim, what it's looking at, the key 3 points that was focusing on: equitable, or rather equity, affordability, and quality. And this is where you find, to achieve this, there was introduction of factors such as affordable healthcare, that is through the National Healthcare Fund, NHIF. And you find that there was also quality. And so through the devolution system, the devolved government was coming up with health system deliveries that was catering from the lowest cadre to the highest, like now from level 1 all the way to level 5. Another part of the policy was the policy target. So the policy targets, we are looking at what is the specific outcome that the country is trying to achieve. So the policy target for our framework was to attain a level and distribution of health services that is commensurate with that of middle income countries. Remember, at this particular time, our country is a developing country. And so the country is targeting at a level whereby we are looking at a state where our healthcare could be at similar level with other middle income countries. And with this target, we are targeting to have a 16% improvement in life expectancy. There was also looking at 50% reduction in annual deaths, and there was also a target of 20% improvement in years lived with disability. So you can see the key targets here: improvement in life expectancy, reduction in annual deaths, and improvement in life lived by people living with disability. So these were the key targets for our framework. Next focus is what we call the policy focus. And with the policy focus is which are the key obligations that the health sector will be focusing on. So the policy was focusing on the human rights-based approaches or human rights. And where do we get our human rights in Kenya? We obtained these human rights from the Constitution of Kenya that was approved in 2010 or 2010. And again, we are looking at health contribution to development, and our developmental plan that is guiding us is the Vision 2030. The key parts to look at or aspect that was checked in the policy framework is the policy actions. So which are the key actions that we are going to focus on with this framework? So the government had 6 health service objectives and it had 7 health investment orientation. So we will look briefly into these objectives and its orientations. So these are the policy objectives that the government wanted to focus on. Number 1, the government wanted to focus on elimination of communicable conditions, that is, reducing the burden of communicable illnesses, such as infectious diseases. The government also wanted to reduce or reverse the rising burden of non-communicable diseases. A good example is diabetes, hypertension, cancer, and so on. And then the other case was reducing the burden of violence and injuries. Objective number 4, the government wanted to provide essential health services that are affordable, equitable, accessible, and responsive to the client needs. Objective number 5 is to minimize exposure to health risk factors and work more on health promotion services. And lastly, objective number 6 is to strengthen collaboration with health-related sectors. So this is now where we have the adoption of health in all policies approach. So these are the 6 objectives that the Kenya Health Policy Framework 2012 to 2030 was focusing more on. It focuses on communicable conditions, reducing the non-communicable diseases, reducing the burden of violence and injuries. Number 4, ensuring provision of essential services that are affordable, equitable, and accessible. And the other one was to minimize exposure to health risk factors and working more on health promotion services. And lastly was to strengthen collaboration with other health-related sectors. Policy orientation. So how was this policy oriented? So the policy had focus areas that was giving more focus on, or rather is still giving more focus on. Number 1 is ensuring efficient service delivery system, providing a comprehensive leadership that delivers on the health agenda. Number 3, the policy was to give equitable and equitable distribution of human resources for health. That is ensuring adequate health workers have been employed to ensure everybody can easily access health services. The other part was it was to ensure adequate financial allocation and mobilization, and to ensure that these finances have also been utilized to ensure that financial risk have been assured. And number 5, the policy was to have adequate health information, for example, through research and evidence-based decision making. And the other orientation was to ensure universal access to essential health products and technology. And lastly was to ensure there is adequate and appropriate health infrastructures. So as you can see, this policy framework is quite broad, direct, and build up on the bigger vision of what the country is targeting on. So these are the key orientation, meaning whatever the government or the healthcare policy planners will be working on, will be working and guiding all these policies based on what the government was focusing on. from the service delivery system to leadership, to equity, finances, health information, essential health services, and even health infrastructures. All right, having understood the different objectives, orientation that had guided the Kenya Health Policy Framework 2012 to 2030, the policy also had principles, and by principle, we more look like what are the approaches that was focusing more on to ensure that we have service access and affordability to each and every Kenyan. So one of the principles of the Kenya Health Policy Framework was the equity or adaptation of equity in terms of distribution of health and its health intervention. And for those who've been around with me, you've understood that equity looks into the state of fairness and a state whereby you are able to distribute resources based on the needs of the population and not just on the numbers or looking at equality. The other principle was a people-centered approach, whereby the government wanted to adopt more of people-focused approach when it comes to health and its interventions. There was also a participatory approach to the delivery of these interventions, whereby we are able to engage each and every member of the community in delivery of these activities. And in that, you find now the delivery system was now diversified, having all the way from level 1 of healthcare service delivery all the way to the level 6 of healthcare service delivery. And then we had the multi-sectoral approach where we wanted to maximize on the health goals, ensuring that each and every sector that could have an input into the delivery of healthcare services could be invited in to ensure that we work towards the common goal of achieving the health policy for Vision 2030. And then we had efficiency in application of health technology, and that is adopting new treatment mechanisms, adopting new treatment technologies, more so, for example, in cases of cancer management and treatments. There was a lot of technology inputs, and the government has put its energy into ensuring that we receive such. And then we have the social accountability, whereby in each and every intervention put in place, then the needed leadership can be accountable enough for it. And to finish up lastly on now looking at the key directions that the Kenya Health Policy Framework wanted to focus on. And we have started with the key orientations and principles. We've looked at the policy objectives and strategies. And the main goal for the policy was better health in a responsive manner. So there are these key principles that we wanted to work on, and that is participatory approach, people-centered approach, and equity and affordability. But to achieve this, equity and affordability, we also have on the other side here, efficiency, multi-sectoral approach, and social accountability. So these are the principles we've mentioned that guided the health policy framework for Kenya. And with all this in place, then we are able to bring in the policy orientation areas, and that was focusing on the area of health financing, health leadership, in the cases of health technologies, health information, health workforce, health service delivery system, and the health infrastructure. So the middle one is referring to the policy orientation, the areas which the government wanted to focus on in terms of achieving the Vision 2030 health policy. So health financing was part of the orientation, health leadership, health products and technology, health information, health workforce, service delivery system, and health infrastructure. Now, to achieve all this orientation, there was now the input of the principles. The principle of equity, people-centered approach, participation approach, efficiency, multi-sectoral approach, and the social accountability. This orientation were now being brought together by the policy objectives and strategies. So the government objective mostly was to ensure there is quality and safe healthcare services and to ensure that there is physical and financial access for members of the community. But to achieve this, we needed to eliminate communicable conditions, reverse the burden of non-communicable diseases, reduce the burden of violence and injuries, provide essential healthcare services, minimize the exposure to the healthcare risk and work more on health promotion, and then strengthen collaboration with other health-related sectors. With all this well put, then you're able to get better health in a responsive manner. So I hope with this class you have enjoyed and understood how the different types of health plans can actually influence a government economy and activity. And for this, we were focusing more on the Kenya health policy framework. We've looked at the different parts, the goal, the aim, the direction, the orientation, the objectives, and the main goal for it for Kenyans was to get. So thank you so much for staying with us to the end. And if it's the content you love or the content is impactful to you, you can subscribe, share, and comment. And for now, it's bye-bye till we meet in our next class.